Hello, I'm Dr. Niki Munk, Associate Professor of Health Sciences at Indiana University in the School of Health and Human Sciences. I'm also the MMA Fellow with ARCM Leadership Training Group, and I'm so excited to be talking with Dr. Amie Steele about massage and myotherapy research and also the Practice-Based Research Network, PRACI. I'm excited for all that we'll get to share, and I hope you enjoy.
Hi, it's Rob Granter here. I'm really looking forward to presenting at the Massage and Myotherapy National Conference in Adelaide in May this year. It's going to be so brilliant to catch up and interact with old colleagues and get to know some new ones. We've all greatly missed these opportunities to come together. So I'm a myotherapist based in Melbourne and a very proud life member of the association. And I'm going to be one of a panel of 4 speakers discussing and demonstrating our specific approaches to the assessment and treatment of shoulder pain. So I injured my shoulders very early in my career. I was too enthusiastic and I wasn't conditioned and wasn't paying enough attention to my form. And it resulted in some injuries that I sustained and had to work with for many years. And I don't want you to repeat my mistakes. I ended up having surgery in both my shoulders, so that's a negative thing in some respects, but it's positive because I have so much information to share with you in relation to treatment and rehabilitation because of those journeys. So exactly on that note, I'll be discussing ways to protect ourselves as therapists from injury, things that we definitely should avoid, especially with shoulders, things that we can do to make us more resilient. So there isn't one way to treat a shoulder, of course, as there are countless factors that could be at play in relation to creating dysfunction. So I'll be endeavouring to provide you with a clinically useful structure to make sense of your assessment and to therefore guide your treatment. So I'll be demonstrating some direct soft tissue techniques and some joint mobilisation. So I'll be demonstrating the use of some very simple, low-cost tools that I find to be incredibly effective. And we'll also talk about some appropriate rehabilitation ideas that, again, are appropriate to our assessment findings. So once again, I am super excited and really looking forward to presenting at the National Conference in Adelaide in May this year. And I'm really looking forward to catching up with you if you'll be there too. So see you there.
Hi everyone, I'm Davey and I'm here with Nathan Wilson, who is our 2021, it's hard to believe it's 2022, our 2021 Athol Robinson Award winner. So welcome, Nathan.
Hi, Anne. Thanks for having me.
That's great. Yeah. All right. So for those of you that don't know, Athol Robinson was a force to be reckoned with in the 90s as far as massage therapy, and he was very, very active in mentoring and continuing professional education in the sector. And so a few years ago, the association created a scholarship to help graduates or those that have graduates in the last 12 months to help them progress in their career, get their career going. So, and Nathan applied for it at the beginning of 2021. So do you want to kick it off, do you want to tell us what led you to apply for the scholarship?
Yeah, sure, Anne. So basically what led me to apply for the scholarship was I guess I saw the advert through the Massage and Myotherapy Australia journal myself and sort of had that in the back of my head. And then my mentor at VFA Learning Geelong, Jerry Sedgman, sort of fronted me about it and said, look, I think this would be a great opportunity for you. And then from there, we sort of drilled down into what the award was going to offer and really, really liked the idea of being able to continue to evolve as a remedial massage therapist and to quickly gain the required skills and fast track the career in the right way.
Yeah, I suppose when I first met you in our first meeting with the Chair of Education, Raylene Clark, and you knew the direction you wanted to go in. You know, sports was the direction that you wanted to go in, and I'm thinking, how can we help this person? They know the pathway, but do you want to talk a little bit about what we've done over the last 6 or 8 months that has helped you along that pathway to focus?
Absolutely. Yeah. So I think like one of the biggest things that's helped me along the way is having the accountability. And we've spoken about it through the journey, having yourself, Anne, and Raylene as well as accountability partners for myself, making sure that instead of just having ideas in my head about where I need to go with things and how to progress, that we actually address them in a timely way and move on with it. And the other thing that's been super beneficial, both with yourself, Raylene, and also other key players like Kevin Skillen, who's also been wonderful to me, just being able to point me in the right direction as far as which are the correct PD courses to do, who are the mentors and the industry contacts I should be making, and just developing a really clear pathway to be able to get from that new graduate position into that sort of sought after therapist.
Yeah, and I think that's a really valuable thing that the scholarship does, is that it does connect you with a lot of people that you may have eventually connected with, but not so quickly, to help provide that clarity of where you want to head. Yeah,
I totally agree.
Yeah, and the latest thing that we've done with you is you've worked with one of the lecturers, I think down at Geelong, on communication and all sorts of communication within the clinic room, not just taking a client history and greeting people. Do you want to talk a little bit about that?
Yeah, sure. So recently I met with Jill Kaufman, who's a shiatsu therapist herself, has worked in sort of the tertiary education sector, teaching massage and communication, but she's also a counsellor as well. So what we were able to do, and something I really wanted to address throughout the award over the 12 months, was to really hone in on developing my massage-specific communication skills. So as you say, not just the how to be polite and say good morning, how has your day been, but to really pick up on sort of some key aspects of reading body language and how to deal with different situations to make both the client and the therapist, I guess, feel comfortable and sort of develop that rapport between the two people in a really nice way, and just have some tools in the back pocket to work through all those sorts of things.
Yeah, it's so important in this industry. Communication is key to everything, isn't it? Yeah. So, well, Nathan, you've recently written an article for our May edition of our journal, so not the next one, the one after, that will hit our members' desks in May, as I said. So everyone can read more about it there, about Nathan's journey throughout the Athol Robinson Scholarship, his 12 months. And applications are open now for the 2022 Athol Robinson Award. So if you hop on to massagemyotherapy.com.au and download an application, it's very, very valuable, and we look forward to receiving everybody's applications. So is there one thing, just on that note, is there one thing that you'd like to say to anybody that's contemplating applying but hasn't quite got there yet? And, don't hold back. Apply.
Absolutely. You've hit the nail on the head. I'd say just get out there and do it. I mean, it's a really rare opportunity, and it's, as I said, it's been a privilege to be able to participate in the award. But there really is not very many opportunities out there like this one. It's out there for you to make the most of. It's out there for you to tailor to your specific needs, whatever they may be. And it's a really good opportunity not to just further yourself as a practitioner, whether that be a remedial massage therapist or a myotherapist, but also a platform to get out there and promote the association a little bit as well. Talk to your fellow colleagues and the general public about, you know, what the award is, what you're learning, and how Massage and Myotherapy Australia is helping therapists and helping the public.
Yeah, exactly. So, as I said, jump onto our website, and thank you so much for your time, Nathan. It's great to have a chat.
You're welcome. Good to see you.
You too. Thanks.
Hi guys, I'm Garry Lavis, and I want to talk to you today about the upcoming Massage and Myotherapy Australia 2022 National Conference. It's going to be in Glenelg, South Australia, at the Stanford Plaza on the 28th and 29th of May. It's been a long time since I've seen you guys at a national conference. Last year we had our very first virtual conference, and it was a great success, but there's nothing like that face-to-face format, and I'm really looking forward to catching up with you guys there. This year we've got something unique. We've got a 4-part, 4-speaker series on approaches to the assessment and treatment of shoulder pain. It's going to be 4 presenters with 4 different views on how they approach treatment and assessment. We're going to talk about basic anatomy. We're going to talk about dysfunctions of the shoulder. We're going to talk about common shoulder injuries. We're going to touch base on things like scapular dyskinesis and the important role that the scapula plays in the stability of the shoulder. We're going to touch base on things like frozen shoulder. We're going to cover a whole range of shoulder dysfunctions. And to me, that's my passion. And why is it my passion? Because I've had 2 complete shoulder reconstructions, and I have a really, really good understanding of the sort of rehabilitation that's required post-shoulder surgery and the severity of the injuries that you can have. So anyway, this looks like it's going to be something fantastic. I'm one of the speakers. I'm really passionate about the shoulder, and I'm really looking forward to presenting this shoulder series to you guys at Glenelg, South Australia on the 28th and 29th of May 2022. It's going to be great to get back to that face-to-face. See you guys there.
Hello, I'm Dr. Niki Munk. I'm an associate professor at Indiana University in Indianapolis, and I'm also the MMA fellow with ARCM's Complementary Research and Leadership Program. I'm here to introduce Dr. Amie Steele. She is a senior research fellow and lead of the practice-based research stream at ARCM. And we want to talk to you guys today about practice-based research networks. Hi, Amie. It's nice to see you.
Hi, Niki. Lovely to be here with you.
So real quick, practice-based research networks, we often will call those PBRNs. And we want to be able to introduce to you guys what PBRNs are, and then also talk with you about the relaunch of PRACI, which is a large complementary and integrative medicine focused practice-based research network. So Amie, a lot of people probably don't know what PBRNs are. Why don't you tell us a little bit about what they are?
Well, practice-based research networks are a type of infrastructure for setting up relationships and how between researchers and clinicians. So that's how I often describe them. Researchers, of course, we have lots of training in methodology and access to resources to help research happen in a way that's really rigorous and well respected. But we don't always know what's going on the ground. We don't always have good access to patients. We don't have a lot of the practical and clinical knowledge that comes from providing care. And so that's what the clinicians have got that. And so the PBRNs provide an infrastructure that allows researchers to work with clinicians to develop and run really good quality research that's clinically relevant, and for clinicians to help support researchers by providing that clinical to ensure that research, that relevance happens for the research.
Absolutely.
So been involved in PBRNs yourself in the United States. I mean, what is that what you would say?
I would. In fact, so I've had my foot in both worlds of this. So I've been a massage clinician for many years, and then I went and got research trained, and now that's what I do full time. And as I'm trying to launch my research programs, realizing that there were some pieces that as a researcher, I really didn't have the sort of access that I would expect to have to be able to conduct the type of research studies that I wanted to do. And there's a real disconnect between the types of things that as a clinician and my engagement and involvement in research lacked, and then as a researcher trying to get access to the things that I would have had as a clinician. And in fact, there's a great image that we've put together that we can share that highlights the different pieces and expertise aspects that the clinicians have that researchers don't necessarily have, and then the pieces that need to happen with research that researchers have access to that clinicians don't necessarily have. So if there's a lot of clinicians that are interested in being engaged in research, whether to conduct it or to be a participant or to provide the interventions for those, but they may not have the skill sets or the design or the funding to be able to do that. So these PBRNs are able to serve as that bridge, right? So I love that, the hub idea, the repository of members, people all interested in wanting to be engaged in research activities.
Absolutely. And what I found, I love this image too, because what I found is when with the PBRNs that I've been involved with and led, that one of the things that happens as a result of having this infrastructure and these bridges already connected and just in place, ready and waiting for good research to happen, is that good research then does happen. And you end up with researchers who would not ordinarily have conducted research with a particular group or population, realizing that a lot of the hard work of setting up that infrastructure is already being done for them, and they're able to start conducting research in this space by working with the clinicians in that area. And certainly with the PRACI, which you mentioned earlier, that's some of the things that's definitely happened through PRACI. We've seen really great research starting to arise simply because the PBRN existed in the first place, and we had that repository, that hub of practitioners in place. And it meant that the researchers knew that there was a group of people who were already interested and willing to support research that they could reach out to. And it helps to supercharge research activity in the clinician topic area.
Absolutely. Well, there's a lot of people I want to go back to PRACI too, specifically because it is the largest PBRN that includes all manner of clinicians, including massage and myotherapists. And my understanding is that of the different professions that are in PRACI, that massage and myotherapists make up one of the largest proportions. Is that right?
Absolutely. Yep. So there's over 1,500 people, practitioners in PRACI as it stands, and at least 2/3 of those are massage therapists, myotherapists. So it's a really great proportion, and that's largely in part to the amazing support that MMA gave to PRACI when it was established in the first place as well. It was really very much that level of support from MMA which helped make that happen. Which is fantastic, and we're going to be actually relaunching PRACI and giving an opportunity for other practitioners who didn't get a chance to join the first time, whether they've since joined the profession itself, or they just weren't able to commit at the time that we did the first launch of PRACI. We're going to have a refresh of the membership and give an opportunity for others to kind of get on board and be a part of the work that's progressed from that.
That's excellent. And it's funny, there's so much parallel that's happening down where you guys are in Australia and then where I am in the United States, because we have MassageNet was a PBRN that was established back in 2010, I think. And it sort of has gone dormant. And the Massage Therapy Foundation, I'm a trustee with that organization. We are in process of relaunching as well. So we're doing this in tandem. It's pretty exciting with the potential that we may be able to even combine information down the line or what have you. But I'm really excited about that. And we'll have more of these conversations where we can talk a little bit more about how clinicians may be able to get involved and what sorts of activities they may be able to participate in as part of PRACI, but that'll be for our next conversation. How does that sound?
That sounds perfect.
Well, it's great to see you.
You too. Thanks, Niki. I'll speak to you next time.
All right.